We've been reporting now for just about the past hour as we waited for the president to depart from the South Lawn. I want to bring in Ben Tracy at the White House, who has additional reporting. Ben?
So, Nora, I just saw some playback of the video of the president leaving the White House, which everyone will soon see in a couple of minutes once it's turned around to all of the networks. I can tell you the president was wearing a navy blue suit. He was wearing a ball cap. He waved at the reporters. He gave a thumbs up. He was walking on his own, and I will say he was walking fairly briskly. He then boarded the stairs of Marine One. He actually tapped the handrail a couple of times as he was getting on the helicopter. So he did appear to be in good spirits despite what is currently going on. We will all see that video here in just a few minutes. He did not stop to talk to any of the press that was outside on the lawn. We're told that Chief of Staff Mark Meadows was accompanying the president. First Lady Melania Trump was not. That is understandable given that she has coronavirus. Obviously, they want to keep her isolated here at the White House.
And Dr. LaPook, we watch now as the president departs the White House. A walk that no doubt the president did not want to take as part of his presidency. I can't recall a time we've seen the president wearing a mask while departing the residence onto Marine One. You can see his military aide carrying what is called the football, the nuclear codes accompanying the President of the United States, as well as other members of the White House staff, all wearing masks. The president's detail accompanying him, and also putting their own health at risk, we should note, because of the deadly nature and infectious nature of coronavirus. As Ben noted, the First Lady of the United States is not accompanying the president at this hour. Our understanding is that she is remaining at the White House. The First Lady of the United States is 50 years old. The President of the United States, 74 years old. There is increasing concern for older Americans when you contract the coronavirus. It is a cruel infection, and certainly for older Americans it does. It just infects them differently. It is the nature of the virus. Even for healthy 70-year-olds, it can be a very cruel disease. And I'll ask Dr. LaPook to just, as you've known many healthy 70-year-olds who contracted the coronavirus and got very, very sick. And
who have died, unfortunately. And it was one of the crushingly disappointing things about treating all the patients at NYU Langone at the beginning of this crisis in April, that so many of the people got sick so quickly. And they died despite our best efforts. Fortunately, our treatment has gotten better. It's not perfect, of course. It's gotten better. And we do know what to look for in terms of people going south, as we say, and starting to deteriorate. So again, I loved how he walked. I love the little taps that he did at the end on the banister there, on the guardrail. It showed a little bit of pizzazz in him. But I suspect that inside of him, without projecting too much, there's a true understanding of the seriousness of the moment, and just hoping that things turn out okay.
People are looking at this shot and noticing multiple helicopters. Marine One always flies in a group with identical helicopters. Sometimes there's actually as many as 5 of them. One helicopter carries the president. Others serve as decoys in case there would be an assassin or something like that. It is a precaution that's always worked for the President of the United States. There are multiple helicopters, so that's why you're seeing now what looks like multiple versions of Marine One. That is how they practice. If you've ever been to the Washington, D.C. area, sometimes you see them running the practice runs, the multiple helicopters together. That is part of the safety and security that accompanies the President of the United States because of his great and vast power that accompanies the president. And John, I hate to even think about this, but I noticed because the president does travel with such an entourage, even though if you or I as civilians were to get COVID-19, we would be required to isolate, totally isolate. And yet in this case, really, the President of the United States can't isolate. He has to have some people around him.
Yeah, but those people are going to be, I checked with some public health officials about this, they'll be in full PPE, full protective equipment.
At the hospital, but the ones that traveled with him on Marine One.
Oh, on Marine One, they actually even then should have masks. They should have visors. They probably won't have gowns, but you know the big spread is through the air. So if you have a good mask, I don't know if it's N95 that they have, and a visor, that's something that certainly would be recommended for people in close proximity to him. In addition to gowns and gloves.
Yes, sure, absolutely. And I want to note now we see Marine One. It was obviously a very quick ride across town, less than 10 miles, as that has landed now at Walter Reed. Major Garrett continues to join us. Major?
So I noticed, Nora, those boarding Marine One, a much smaller staff accompaniment for obvious reasons for the president. And this goes back to the need for the White House to explain how this is all going to play out. How will the president deal with his obligations, his duties, his responsibilities as president while he's at Walter Reed? Because the White House says he's going to work there for a few days. Is this going to be a teleworking White House for the next couple of days? It looks like it will be. That would be something that the White House could and should fill in terms of the workability of the president under these very challenging circumstances. When you saw those boarding Marine One, you quite accurately pointed out those were all, or at least predominantly to my eye, military aides. I did not detect anyone from the senior White House staff. Mark Meadows might have joined the president. I didn't see, but it would be logical for the chief of staff, but very few others. So this raises just general, basic continuity of government issues and questions, all of which the White House, because it's formulated this plan, can and should answer sooner rather than later.
Major Garrett, thank you. It is 6:30 on the East Coast, 3:30 in the West. We just want to recap for a moment for viewers who are just tuning in to this CBS News Special Report. President Trump has just landed at Walter Reed National Military Medical Center after testing positive for coronavirus overnight. The president is going to be there for a few days to be evaluated. We understand from White House sources that the president is experiencing fatigue, that he has had a low-grade fever, a cough, and congestion. As you can see, the Marines accompanying the President of the United States exiting beforehand, just ahead of the president. The president will be staying in something called the Medical Executive Treatment Unit, which is staffed by doctors, nurses, technicians, the finest from America's military and medical professionals, to care for the president out of what the press secretary is calling an abundance of caution. As Dr. LaPook, our chief medical correspondent, has noted, one of the concerns is the president's age. Because he is 74 years old and obese, he is at risk for complications from coronavirus. And the President of the United States wearing his mask, accompanied by his White House Chief of Staff, who is also wearing protective gear, who I believe the White House reported this morning had tested negative